Client and patient safety in healthcare and welfare services. The insufficient safety in healthcare services was brought into international awareness in the beginning of the 21st century when the American Institute of Medicine published a report to Air is Human. The report revealed that healthcare is not as safe as it should be. Some facts to think about. In developed Western countries, approximately every 1 in 10 patients experience some kind of an adverse event during their treatment. This adverse event is serious for approximately 1% of these patients, causing either permanent disability or death. In developing countries, the problems are multiplied. In addition to human suffering, the adverse events cause financial losses. What is patient safety? Patient safety means that the patient is not caused harm that could be avoided and that unnecessary risks related to healthcare are decreased into an acceptable minimum. Patient safety must be a part of the core competence of every healthcare professional. The World Health Organization, who has published a Global Patient Safety Action Plan, WHO Global Patient Safety Action Plan 2021 to 2030. The goal of the action plan is to significantly reduce avoidable harm, to enforce structures that strengthen national safety and to increase the involvement of patients and loved ones, as well as to improve knowledge management which promotes safety. The failure of patient safety is a growing challenge and one of the leading causes of death and disability globally. In addition, the families and loved ones of the patients suffer. The healthcare employees who are involved in adverse events that are serious or cause death might also suffer from long-lasting psychological symptoms, such as feelings of guilt. Errors in patient safety cause high costs. Errors and adverse events decrease trust in the healthcare system. However, most of these harms could be avoided. Client and patient safety. The World Health Organization, who doesn't mention social welfare clients in its system. Regardless, many goals of the system are applicable to the promotion of client safety. Social welfare in healthcare must be high quality, client-centric, safe, and properly executed. Healthcare must be based on evidence and on good treatment and operating practice. Client and patient safety refer to the principles and practices of people and organizations working in social welfare and healthcare that ensure the safety of treatment and services and protects the clients and patients from harm. Client safety in social welfare refers to organizing, producing and implementing services in such a way that the client's physical, mental, and social, as well as financial safety aren't at risk. Client and patient safety are a part of the quality of healthcare and care services. An open culture is pivotal in the realization of client and patient safety. Defects and errors are noticed and they are openly brought up. The goal is that something can be learned from them. Client and patient safety means procedures in place to ensure the safety of treatment, such as using various checklists. Ways to protect the client or patient from harm, for example, designing the window of a patient room to open only so much that there's no risk of falling out of it. Giving the right treatment to the right person at the right time, for example, using an identification wristband on a patient. The main concepts. An adverse event is a patient safety incident that causes harm to the patient. A near miss is a risk situation that could have caused harm to the patient. Harm was averted either accidentally or because the anomaly or risk situation was noticed and the harmful consequences could be prevented in time. Hazard is a circumstance, factor, or an activity that could possibly cause harm to the patient. A patient safety incident includes both near miss and hazard situations.